Okay, hi Miss Brown. This is your favorite student in the whole wide world. This is Alexia. This is my best friend, and she's going to be my patient for this video. So I hope you enjoy. Okay, so this is my video project. I'm doing it off the antepartum prenatal simulation scenario. This is Jasmine Carter. She's a 27-year-old female, African American is her ethnicity. Her GTPAL is G1P0. So this is her first pregnancy. She is married to Marcus Carter, and she has a strong support from her mother and her sister. She is of the Christianity Baptist faith, and she believes in praying regularly and modesty. She lives in an apartment with her husband, middle class income, employed as a teacher, fluent in English, and she has health insurance. Her risk factors for this pregnancy that we're a little concerned about or keeping in our mind is that she's mildly obese. Her BMI was 31, and her family has a history of gestational diabetes. Hi, Jasmine. Congratulations on your positive pregnancy test. I'm Nurse Cheyenne, and I'll be reviewing your first prenatal visit and what to expect over the next several months.
Thank you. I'm excited but a little nervous. I've never done this before.
So now I'm just going to listen to your heart. I know out there they had took your blood pressure and got some vital signs on you. Your blood pressure was really good. Just listen to your lungs. Take a deep breath for me. Okay. Okay. The lungs sound good. Heart sounds really great as well. Your blood pressure was good. It was 120/80. Your heart rate was a 70. Your respiratory rate, which is your O2, that was good. It was 99%, which is amazing. Everything looks really well. So today we're just going to run some labs to make sure you and your baby are healthy. You can estimate your due date based on your last period. So when was your last period?
Let's say, what is it, October? September 5th.
Okay. And we will do your first ultrasound will confirm the baby's growth and heartbeat. Today, you could just expect to get your blood drawn. They're going to look at your CBCs, which is your blood count. Just looking at to test you for like Hep B. It's also going to be looking at potentially, if you give consent, testing you for HIV and syphilis. Those are things that we like to do continuously through the pregnancy, just for the safety of not only you but your baby. We're going to do RH and your type blood, what type of blood you are, and your hemoglobin and hematocrit. And those are just measuring to see, are you anemic? What are your levels? What are your baselines? So that's mostly what you can expect today. And your first ultrasound will typically take place 8 to 12 weeks from now.
Okay.
Well, when you're around 8 to 12 weeks. So as you know, pregnancy comes with a lot. We have a lot of expectations for you as a mother, not only for the safety of you, but again, the baby that you're carrying. So we're expecting you to avoid alcohol, smoking, any high mercury fish, and unpasteurized foods. Increasing your hydration, making sure you're drinking water frequently. You're doing some extra moderate exercise and doing like walking and yoga. And then making sure that you're eating a balanced diet. Things that will be like protein, whole grains, and things of that nature. And you're also taking your folic acid, which helps prevent birth defects for the baby. So we want to make sure you take your prenatal vitamins every day, and also try to eat colorful meals. Um, so your baby can get those nutrients. And then when it comes to as far as pregnancy, we understand that you can have some risk. So some of the things I want you to look out for throughout your time and your duration of being pregnant is any unsolicited or unprovoked vaginal bleeding, severe abdominal pain, persistent vomiting. Within the first trimester, it's normal to be nauseous and vomit. But as time go on, if you're persistently just throwing up, that's something you want to let us know about. Headaches, blurred vision, swelling of the hands and feet, and decreased fetal movement. So once, like I get said, you progress in your pregnancy, if you're noticing your baby is not moving as much, those are things that you want to come to us, and you want to contact your doctor and or go to the ER immediately. And then as time go on, we would love to know when you get closer to your due date, what is your birth plan? Who do you want in the room? What does labor look like for you? Do you want Mr. Marcus to be there? Do you want your mom and your sister there? We want to make sure we're doing everything that's comfortable and safe, not only just for you, but your baby as well. So the receptionist mentioned to me that you did tell them that you were experiencing some nausea and vomiting. So as I stated before, one way you can help with that is by making sure you eat some dried carbohydrates, so like a saltine cracker. Keep them next to your nightstand in the morning, and before you get out of bed, just make sure you eat a little bit, and try to avoid having an empty stomach as possible. That can really help. You can also, I know you mentioned to the receptionist about genetic testing and concerns regarding your risk, the risk of you having gestational diabetes. So as far as the genetic testing goes, that typically takes place about 10 weeks or later. But those are the things that can happen, and once we get closer to that time, we will go in more depth of what to expect. But typically it's non-invasive, and it's just to see what your baby could potentially have or not have. As far as their diabetes, we will do a glucose tolerance test, and basically we're just trying to see, is your body able to lower your blood sugar after being like ingesting a whole bunch of after eating so much sugar, can your body be able to regulate it back down to a normal blood sugar range? So those things to take place. If you potentially fail the first one, you can do a second one, and then after the second one, the main thing we would recommend is just better dieting and eating. And when we say dieting, we just mean in different foods that will be more healthier for you and your baby. If that doesn't fix it, then we'll look at medications. So is there anything you would like to ask or say?
I know my husband isn't here with me today, but I want him to be involved at every appointment.
And that's absolutely what we will want. Pregnancy is one of the most vulnerable and sacred times that a woman can go through. So it's important that you do have family, you do have friends around you. So we would encourage Marcus, your husband, as well as your mother and sister, whoever else you're comfortable with, to come to your appointments, to experience this with you, because we all know a village is better than just individually doing this alone. And we also understand that your religious beliefs is very modest and very private. So we do offer privacy and gowns, and we definitely will respect your wishes and your religion by being respectful with our language and the things that we say and we do. But I am first of all, congratulations again, Jasmine. I'll schedule your next prenatal appointment for 4 weeks from today. Keep taking your vitamins. Call us if you have any concerns or questions. And it was so good to see you today.
Thank you, Nurse Cheyenne. I feel much better knowing what to expect.
You're welcome.